4-month-old Grayson Perry, his tiny belly rapidly expanding and contracting. One of many children here with COVID-19 struggling to breathe.
Are you afraid they're going to have to intubate him?
Yeah, a little bit. It's just really scary. So I just hope that, he's able to get better and go home.
Gayville Goff, mom to 3, thinks her youngest picked up the virus at a Christmas family gathering. Her only job now, keeping her son in good spirits.
I do talk to him in like a little baby voice. I sing to him. I can't sing, but he likes it.
One of nearly 70 children now hospitalized at Texas Children's, a new record high for the nation's largest pediatric hospital. In just the last 2 weeks, hospitalizations here have increased more than 4-fold. Most unvaccinated or not eligible for vaccines, from toddlers to teens.
Our COVID journey began don't even know my days. Brains are mashed potatoes. We began November 29th. Me and my daughter both tested positive for COVID.
Amy Woodruff's daughter, Haley, her 17th birthday, the day we visited, has been intubated in an induced coma for nearly a month. She also gave birth nearly 3 weeks ago. She knows none of it.
She had a C-section in Amarillo on December 9th to a beautiful little baby girl, 3 pounds, 6 ounces.
Who she has not seen yet.
She has not seen. And she was COVID negative, praise Jesus.
From Pampa, Texas, Hallie was moved to Amarillo, then Houston for advanced care. Still unaware, her 3-week-old daughter, Zyla Faye, is 900 miles away in an Amarillo newborn intensive care unit.
What will you tell her when you can speak to her?
I don't even want to think about it. That's my little girl. Being away from her little girl. My heart bleeds for her.
The Omicron variant now ripping through the Lone Star State. Texas Children's preparing for even more sick kids as COVID-19 cases skyrocket.
What is your sense for what the next few weeks are going to hold?
I think the bar for resilience just keeps moving. You think that, I don't know how we could do this again, and then we keep doing it again.
As Texas Children's readies for a 4th coronavirus wave, already its ER is seeing a spike in kids suffering mild symptoms, their parents seeking testing, bogging down triage for the seriously ill.
We're seeing a lot of patients present with mild respiratory symptoms, cough, congestion, fever, known COVID exposures, etc., that are really, I think, a lot of them are really seeking testing.
Like previous waves, the sickest kids, those needing hospitalization, are having a tough time breathing.
So they're getting a lot of respiratory symptoms, as we've been expecting. Pneumonias, needing respiratory support to help them breathe better.
Viral spread expected to intensify in the weeks ahead, and even if the Omicron variant isn't as severe.
The problem is that with so many children and adults infected, even if the percent hospitalization rate is lower, we could see more children hospitalized over a very short period of time. So that certainly puts a strain on our healthcare resources.